Hello everyone. Today we'll be discussing about medication Ertapenem, an antibiotic. It is prescribed treatment for serious bacterial infections such as infection in lungs, your abdomen, urinary tract, skin, diabetic foot, or pelvic areas. This can be prescribed as a prevention for surgical site infection. Let's walk through the medication, how it works, what to expect, and what are the things that we need to consider for children's, pregnant or lactating individuals, or older adults. Pharmacodynamics, how medication works. Ertapenem is a type of antibiotic on the carbapenem group. It works by killing the bacteria. It disrupts the bacteria's ability to build cell wall, which is necessary for bacterial survival. So this bacteria, this antibiotic would not allow the bacteria to form their cell wall, which is necessary for them to live, grow, and spread. Ertapenem is a broad spectrum antibiotic, which means it can treat various different bacterial infections, but it is not effective against any viruses like flu or COVID-19. Pharmacokinetics, how medications absorbed in our body. On administration, ertapenem is administered via intramuscular injection or on your muscle or intravenous infusion as a piggyback. It is never administered as IV push. This medication cannot be mixed with any other medications or cannot be diluted with other that contains dextrose. Absorption, when medication is given through IM, it's almost completely absorbed into the muscle and reaches to bloodstream. With IV administration, medication enters the bloodstream and is delivered directly. Distribution-wise, once the medication's in the bloodstream, it is widely distributed throughout the body, including tissues and fluids where the infection is present. Metabolism, it is not metabolized by the liver, so patients with impaired liver function, they can still get this medication. Elimination, this medication is almost completely eliminated, about 80% by kidneys and 10% through feces. This means kidney function plays a big role on how quickly the body clears the medication, and the doses needs to be adjusted if the patient has impaired kidney function. Ertapenem has a half-life of about 4 hours. Like all the other medications, ertapenem can cause side effects. Most are mild, but some may be serious. Some common side effects include diarrhea, nausea, vomiting, headache, pain, redness, or swelling on the injection sites. Some more serious side effects include allergic reactions like itching, swelling of the face, rash, or difficulty breathing. Other includes seizures, like especially in people with a history of seizures, or if the dose is too high. And other ones is the Clostridium difficile, which is C. diff. It's a severe diarrhea that disrupts the normal flora of the gut. So if you have like persistent diarrhea, confusion, or seizure-like symptom, you need to seek out for medical attention right away. Special consideration for children's, ertapenem is approved for the children older than 3 months old, so it's not recommended for infants younger than 3 months, and dosing is based on child's weight. It is usually given in the hospital or clinic setting. Extra care or precautions should be taken, and we need to monitor for signs of seizures or allergy on younger patients. Pregnancy and lactating individuals, this medication is known to cross the placental barrier, but there isn't enough human research done. So it only had minimal effect on fetus on animals, so it is considered generally safe to use in pregnant patients. It is also distributed in the breast milk, but in very small amounts, so it does not affect or harm the baby. Geriatric population, older adults may be more prone to side effects like kidney if they have an impaired kidney function. So we need to take special attention if the patient has impaired kidney function. Since this is the neurotoxic effect of this medication, confusion and seizures are more likely in this age group. For all patients, hydration and monitoring of kidney functions are key during the treatment. As always, we need to follow the provider's instruction and complete the full course of antibiotic even if you start feeling better. Thank you.